Hi guys, this is a video for anybody revising for their CASC exam. This is my number one top tip, and that is that your first impression is so important. Remember, you've walked into a station, you want the patient to think, wow, this doctor is trustworthy, is reliable, and knows what they're talking about. And you want the examiner to think, this is an excellent candidate. I'm gonna, sit back and listen to them talk, right? The examiner does not know how any of your previous stations have gone, so you need to start afresh every station and walk in as though you have just smashed every single station you've been at before and you're about to do the same for this one, okay? So you need to be confident and you need to believe in yourself. And that even comes down to the language that you choose. Remember, this is an exam for you to prove that you are ready to be an ST4 or registrar in psychiatry. So you need to already be acting and presenting yourself as such. So I recommend that when you introduce yourself, you call yourself by your surname, Dr. blah blah, and that you say that you are a psychiatrist, because that is the role that you will be doing. So here is a really super simple introduction that I usually use. It's, hi, my name's Dr. Ashburner. I'm one of the psychiatrists here, and I'd like to ask you a few questions. Is that okay? Okay. That's a really basic one. And I think the easiest thing is to just use something simple that you can use in every single station. Because you don't want to be worrying, okay, where am I meant to be? Am I in clinic? Am I in A&E? Am I doing something else? Something like that you can use in every station. The next bit that you say after that is also important. So make sure you've thought that through, okay? And this is where you can adapt it a little bit depending on the station that you've got. You can add a little bit more information and you can explain the purpose of why you're there. However, you could also use something equally generic that you can use every time. So one that I always went to was, I heard that you've had a bit of a difficult time recently, and I'd like to ask you more about that. Okay? Because that's pretty generic, and for most people it will apply that they've been having a difficult time recently. So that's something you can use all the time. If you want to bring in details of the task, that's fine, and you can set the scene, but don't spend a whole minute going back over what's written on your scenario, because you're not going to be gaining any points. You've only got 7 minutes, so keep it short and sweet. So stick to the point, call yourself by your surname, present yourself as a psychiatrist, and be confident.